Good morning, dignitaries on the dais and off the dais. Thank you, AIOCMT, for giving me this opportunity. I will be discussing the causes of corneal scar among the Indian community and what low vision aids which we can provide them. So we all know that loss of corneal transparency is called as corneal opacity. There are various causes. Just to enumerate: nutritional, congenital infections, injuries, inflammatory and iatrogenic. If we talk about the disease burden, according to WHO, the corneal opacity is the fourth main cause of blindness globally. And out of the 145 million people, 6 to 8 million people are corneal blind. Talking about the India, the NPCB survey says that the corneal opacity is around sixth major cause of corneal blindness and accounts for 0.9% of the total blind population. A very important study, which is the population-based assessment of visual impairment and pattern of corneal diseases, the core study shows that the prevalence of corneal opacity was found to be 3.7% with the bilateral involvement in 31%. It also shows that the most common type of corneal opacity was the macular grade, around 46%. So what is the burden of corneal blindness in India? A study by the Nupur Gupta et al. It was a meta-analysis of the 7 relevant population-based studies which were published from 2001 to 2010 was performed, and it shows that in pediatric population it is the most common cause is trauma, ocular trauma, while in adults the most common cause is the keratitis, and in the elderly population it is the trachomatous keratopathy and the corneal degenerations. Among the infectious keratitis, a hospital-based study on epidemiological profile shows that the fungal keratitis, which is agricultural related ocular trauma, was the principal cause, and the mycotic keratitis is the most common. Among the vitamin A deficiency, a population-based assessment of childhood blindness in state of Andhra Pradesh revealed that the corneal diseases to be responsible for 17% of childhood blindness, and it is the most frequent cause of blindness among the preschool children in developing countries. The trauma, it is most significant cause of unilateral loss of vision in developing countries, and chemical injuries with acids and alkali, they also contribute significantly to the corneal blindness. The pseudophakic and the aphakic bullous keratopathy is also one of the important causes, and in a study involving 2022 penetrating keratoplasties performed in a tertiary eye care center in North India, shows that the bullous keratopathy accounts for 13% of the total cases which are being operated. Corneal dystrophies is in a study which is done to found that the corneal dystrophy, among the corneal dystrophy, it is the macular corneal dystrophy which was most common, and as we all know, the corneal transplant is definitive treatment, but the scope of low vision aids is very less in corneal diseases, as we need all the low vision aids, they need clear cornea. Whether we need for ARMD or glaucoma, we need a clear cornea. But if we do not have clear corneas, the scope of low vision aids is very less, and the corneal scars, they can be managed with the scleral contact lenses. They can convert irregular cornea to a regular surface, and the definitive treatment is definitely the corneal transplant, in whether lamellar or the full thickness. Thank you.
Thank you, Dr. Nitin.